Guys, welcome back to the Chief Life Podcast. I am Matthias Turner, and today I'm joined by Dr. Diana Driscoll. Diana, welcome.
Thank you, Maddie. It's an honor to be here. I really am excited about it.
I am too. I mean, there's a really good backstory as to how you come into, I guess, where you guys, what you're doing, the main work that you're kind of rolling into and helping people with every day. So you are from Pots Care. You do also have some things to do with the vagusnervesupport.com. You have a doctorate in optometry,
Right.
and I mean, we're going to dive really kind of deep into all of these things, but I think typically people get into, not typically, it just happens every once in a while where people get into their practice or their purpose in life due to things that have happened to them in the past.
True.
And I really think your story is so fascinating. And I'd really love for you to kind of dive a little deeper into what happened with you, like where were you at, and how did things kind of unravel for your life to change into what it is now?
Right. What a good question. Such a horrible journey, honestly. And unravel is kind of a good term. It happened so fast. At least I perceived that it did. But I was healthy as far as I knew. I was 46 years old and went on a mission trip to Costa Rica and got a virus. And everyone on this trip got the same virus. I cannot blame this virus. But it was like I couldn't recover. I couldn't pull out of it. I was having trouble breathing. And then I noticed my heart rate was wonky. And I was just trying to give it some time. But as time went by, I just got worse and worse. And the symptoms started to mount. My blood pressure would change. I couldn't control my digestion properly. Food would just sit in my stomach for hours. Changing even my position would change my heart rate dramatically.
Yeah.
I couldn't handle a single degree of temperature change, either colder or hotter. I couldn't adapt to that. And then as time went by, it started to morph more into, I developed a tremor, started to develop some neck pain, headaches. Then as it went further, I lost the ability to sleep. I could not fall asleep. I had the worst insomnia. Then it felt like I was flooded with adrenaline. If you just touched me, I jumped 3 feet in the air. Then I started to have trouble with my cognition. I would lose words. My short-term memory was starting to suffer. And then as it continued to progress, I got to the point it was so bad. I was hallucinating sometimes. Then I couldn't stay awake. I was awake maybe 3 hours a day. And during those 3 hours, I had struggled to stay awake. And I just kept getting worse. It was really a horrible journey. And it was 10 years looking for answers. But first I thought, one, this is not subtle. Some doctor is going to recognize this. We're just not getting to the right doctor, right? So I went to...
I mean, a lot of people probably were just throwing out like, hey, it's probably chronic stress.
Oh, it was so much more dramatic than that. The day it hit me, I couldn't even finish the last 2 patients I had that day. I was shaking really bad. I couldn't stand. I couldn't breathe. Sometimes trying to breathe, I'd be on the floor on all fours.
Wow.
It wasn't, and I wasn't stressed about anything that I could see. To the uninitiated, I guess it looked kind of like a panic attack. I would tell the doctors sometimes, it's like my body's having a panic attack without me. That meant nothing to them, you know. What was really scary, though, is our kids got sick, too. And our son was 8 years old when he got sick. And it was a series of 3 viruses that each one just knocked him down further. And he started fainting. And then he started to lose weight. He developed severe osteoporosis, broke his arm just throwing a ball, just putting on his coat, and we went everywhere. And no one could help. No one could tell us what was going on. So I was ultimately diagnosed with POTS, Postural Orthostatic Tachycardia syndrome, which means that when you're vertical, your heart rate goes up. But I would tell the doctors, that's the least of my worries. I can feel the heart rate going up. That doesn't bother me at all. I am sick in every position and all over my body. Could we look at that? They just couldn't. They just couldn't go there. So POTS, I've come to view as it's a symptom, it's a presentation, but it's not a disease. We have to figure out what's causing that in order to treat it.
It's kind of like saying irritable bowel syndrome, right? Like,
Exactly
hey, yeah,
right.
like you've got IBS. It's like, well, that's not the cause. It might be a symptom, but it's not the actual issue.
That's exactly right. Some of those labels work against us, right? I've
Mm-hmm.
heard fibromyalgia or something. No, that's basically useless. We have to
Yeah.
know what's going on much more scientifically, much more exact to be able to treat things properly. But that's what we were up against. So that's how I ended up having to look into it. When the doctors basically threw up their arms, I ended up at Mayo Clinic, which is our big research facility, and I participated in their clinical trials in 3 of them for 3.5 years. I did everything they said. I was getting worse every year, as was my son. And he was forced to miss 3 years of school while we were scrounging looking for answers. But they told me, well, we believe POTS patients are perfectly normal. They're just more aware of their own body. And that's when we decided we've got to dig into this. And we set up a corporation, Genetic Disease Investigators, and started doing studies. I used my disability insurance. I got a lump sum from that. We threw it into these studies and started working on it to try to figure out what was going on. So that's how I ended up. And I had absolutely no plans of going into research or invisible type illness, but it taught me a lot too about health. It wasn't all about illness. And I think for those who are healthy and, crushing it at life, there are ways we can be proactive to be better in so many ways. So you don't have to be sick like I was to benefit from that. And I think that's where it can help so many people.
Definitely. So, I mean, opening up genetic research clinic, what does that kind of look like? Like, what sort of research are you using research that's already been done, or are you taking on new studies?
That is such a good question. If you can imagine the first few years, this research was begun by me from bed. I mean, I had a bed desk and I just spent my time learning about what we already knew about dysautonomia or autonomic dysfunction, digging deeply into some things I didn't learn in optometry school.
Yeah.
And then we did start clinical trials here. Like our first one was looking in the eyes of patients. No one had really done that. And
like an iridology, essentially?
No, past the iris all the way to the retina, where, it's the only place in the body you can look directly at a nerve. You can look at the optic nerve. You can look directly at blood vessels. You don't have to look through tissue. So it can help when we're looking for systemic illness. And I thought, there is no way you can be this sick without something showing up somewhere, So we started there. We didn't end there, but that helped. So we did a series of studies. Then it started to morph into more the genes responsible. And for that, I did depend on others. So hired doctors who are freelancing basically from around the globe, and geneticists were one of those we hired. We depended upon their work, and I would snag the genes when I found what I was looking for and started a spreadsheet. So that's a focus of the research right now, is to nail a lot of those, which will ultimately be so important.
Yeah, freelancers are great for that. We've got a microbiologist who works with us, and she's just insane. She's just so good at finding data and bringing it to life. It's incredible. Yeah.
They are underutilized. We had microbiologists too. I thought, oh, you guys are so smart. And they're underutilized. I think that knowledge is not always put to its best use, which is really sad.
Yes.
But that was extraordinarily helpful.
Yeah, definitely. And so, I mean, where did you go from there? Like you've done your eye study. You said that wasn't the end. That was pretty much the start of it. So what happened? Like how did you kind of progress?
It was. And much of the work, that early on work, I put in a book called The Driscoll Theory that's still out there. But the first thing we discovered was it wasn't everyone, but there was a propensity for high intracranial pressure, high pressure on the brain, but we didn't exhibit as typical. So it was
pressure
very easy to miss.
Like what's the pressure coming from?
Yeah, there's a fluid that surrounds the brain and spinal cord, and interestingly, the optic nerve. So we're always producing that fluid, we're always draining it. But if that balance gets out of whack, the pressure can build. And putting pressure on the brain is bad.
Yes.
And 65, 70% or so of POTS patients were showing that. So that was the first thing we figured out. And then the next layer was figuring out something appeared to be going on with the vagus nerve, and I had to get answers for that.
So what was the signs that the things were going on with the vagus nerve?
Yeah, the first thing when I look back on trying to figure this out, I would create lists of my symptoms. And do you know, Maddie, at one point I had as many as 70 symptoms. So it was a huge list, right? And I was taking these symptoms and trying to cluster them together, saying, if I group them in certain ways, would that guide us as to how these dominoes were falling? And one thing I noticed was the heart and the gut was affected right about at the same time. So I thought, what could tie those two things together? And the only thing I could come up with, well, the vagus nerve does. The vagus nerve serves both of those organs. So I was looking at, did something happen to it? And I was considering it being perhaps compressed. I didn't know, but it was important we figured that out. That was the first clue that I had and wanted to look into.
So let's have a quick pause there. Let's maybe talk about the vagus nerve. Like, what is it? What does it do for the body?
Yes, and it's so important for everyone. All right. The vagus nerve is the longest cranial nerve in the body, and it serves so many different organs. So it goes from the brain down the neck into the heart. It slows the heart, like if a bear is chasing you, or you just lifted a lot of weights or something, your heart's racing. It allows you to calm down and lower that heart rate. It slows the breathing in the same way. The gut is completely under control of the vagus nerve. So it controls every aspect of digestion. It tells the stomach, for example, oh, there's food coming. We're going to spit out a little stomach acid. And then it tells the pyloric valve at the base of the stomach to open to allow the food to exit. It controls motility of food and then ultimately stool throughout the GI tract. So it allows us to have normal bowel movements. But it also tells the gallbladder, something's headed your way. You better spit out some bile to help digest fats. It tells the pancreas, food's coming for digestive enzymes to help digest proteins and fats. It controls a sphincter called the sphincter of Oddi that allows the release of that bile and the digestive enzymes into the intestinal tract. So when that fails, digestion suffers. Malabsorption is more common. Constipation is very common. Gut inflammation is common. But interestingly and importantly, the vagus nerve is also the anti-inflammatory nerve of the body. This was not my work. This was the work of a doctor in the Feinstein Institute of Medicine. And if we're dealing with inflammation, either from illness or from, say, intense exercise, we need to be able to manage that. Otherwise, it starts to destroy healthy tissue. So we depend upon that nerve to do it. If it's not working well, we're going to suffer more from inflammation. So it's an important nerve.
Yeah, that's so interesting. I actually learned a few things there. We talk a lot about the vagus nerve when we go and do talks for stress mitigation, and when we're talking about, for instance, like you're talking about with the gut, like how important it can be, how important it is with all the digestion, but mainly like how you can control your state due to how your breath is and how your vagus nerve is. And if you can activate it in the right way, we can down-regulate stress. Or if we activate it in, I guess it's also a right way, you can up-regulate your stress if you want to. So how breathing can be a better protocol than having, say, a cup of coffee at times for actually waking your system up and getting you ready to do something. And when you're trying to go to sleep, you can really try to utilize the breath to calm your system back down. So, I mean, we do quite a lot of work around the vagus nerve, but never gone that deep into it. So that's why I'm really excited to kind of talk on, I guess, all of the things that we can really dive deep in the studies that you've found. So going back to your story, I think that's a really good insight as to what the vagus nerve is. So going back to your story, you figured out that your heart and your stomach are doing two things at once that they probably shouldn't be doing at the same time. So what was the next steps then into the next steps into your story?
Right. Well, what happened to me, I just got sicker, right? And what started out as some constipation, sometimes punctuated with diarrhea, but a lot of constipation morphed into complete gastroparesis, meaning nothing was moving. And that was miserable. And although a long story, I think the details are probably good because I had to pick this through and very carefully stay in the science to figure it out. But it had been, 11 days since I'd had a bowel movement. And it wasn't just constipation, although that's kind of miserable, but it was that on top of also being so sick. And it was just so much to deal with. But I had tried everything that I knew to try to have a bowel movement and was getting nowhere. So I saw my doctor and she said, well, I have nothing I can add on top of what you've already done. She did test my gallbladder, though, and found that it wasn't working. And she said, the ejection fraction is pitiful. It's 8%. We should remove that. And I said, oh, well, is it urgent? Like, is there gallstones in there that'll be a problem? And she said, no. I said, is it like an appendix? Is it infected and it's going to blow and we have to worry about that? She said, no, it looks fine. I said, well, then it sounds like the organ itself is okay. It doesn't sound like this is urgent, right? So this sounds a little neurological to me, and I really wanted to try to think about it. And I'd like to save that organ if I could. And life is a little easier with the gallbladder. I remember she was a little upset that I didn't go ahead and have it removed. But what she did do, I told her I was having some vague pain in my lower right-hand abdomen area. And she sent me to a urologist saying, maybe this is a strange kidney stone presentation. I was like, okay, from what I've heard, they don't usually present that way, but I don't think she knew where else to send me. So she sent me to this guy, and he was super nice, and he gave me some dye to drink, and he imaged for stones. He said, there's no stones. But because he was so nice, he seemed really smart. And when you're really sick, you'll beg anyone for help, right? And I said, would you listen to what I think is happening, and I suggested the vagus nerve problem. And I said, if that's the case, could some of this pain be the ileocecal valve, the valve between the large and small intestine, and maybe it's not opening properly, and that's the location of it. And he thought that was so interesting. He sent me up the hall to a surgeon friend of his to see if the surgeon could help me. And the surgeon said, oh, Diana, no. If you're suspecting a vagus nerve problem, the last thing you want to do is abdominal surgery. He said, we cause gastroparesis. And okay, I appreciated that honesty.
Yeah, definitely.
So then I ended up in the emergency room, and it had been over 2 weeks at that point, still nothing. They gave me prokinetics, which should push things along, and nothing happened. So I'm at home, and something divine just happened then, because oddly, I got a kidney stone. And I called this doctor and I said, I know you're going to think I'm nuts. I know a few days ago I didn't have a stone. I get that. I respect that. But I do now. And although I'd never had one, you hear the stories, right?
Yeah.
You kind of know what that's like. So he met me at the hospital. Sure enough, I had a stone. He removed it. And when I woke up from anesthesia, he was just standing right there. And I remember him saying, the minute I opened my eyes, he said, Diana, you're right. I said, what? He said, it's your ileocecal valve. So how did you know that? He said, well, that dye I gave you a few days ago is still in there, but it's all crammed up against that valve. They use imaging in order to pull out the stone, and it lights up so they could see it. I said, wow, this is confirmation. I felt a lot of validation. I said, so what do we do? He said, oh, I don't know. I'm just here to remove the stone, But I thought that was really interesting. I was like, okay. So I went home, and this is where I'm in bed by myself, and I didn't know who else to turn to. And I said, I'm on my own again. Let's just assume I'm right. Let's say, what if it is a vagus nerve problem? And maybe it's compressed. I don't know. But if so, what could I do to try to stimulate a bowel movement? And I remembered the anatomy I learned, and do know, Maddie, I am a total geek. So for whatever reason, I have a strange and acute memory with certain scientific things, which probably helps. But I remembered memorizing these nerves and the neurotransmitters, and I thought, okay, there's two parts to the vagus nerve. There's the preganglionic portion that goes from the brain down the neck into the chest cavity, and then down into the abdomen. And then there's a tiny gap, what we call synapse. And then there's a very small postganglionic vagus nerve. And I remember the instructor saying, the postganglionic vagus nerve is so small, it's almost a part of the organ itself. I just remember going, isn't that interesting? And I thought, well, as far as I know, I still have that postganglionic nerve because I have never had abdominal surgery. And that could I stimulate that part of the nerve? Let's say that any part along that long journey for the preganglionic was defunct for whatever reason. Let's work with that little postganglionic piece. How could I stimulate that? And nerves communicate with a chemical, a neurotransmitter. And I thought, what is the neurotransmitter of the vagus nerve? Okay, that's acetylcholine. But acetylcholine is not a drug. You can't inject that into your body. The body breaks it down immediately. So we have to use an imitator of it, or what we call an agonist. So I thought, okay, what is the agonist for acetylcholine at the postganglionic vagus nerve? That, oh, I remember that because the vagus nerve is the only nicotinic acetylcholinergic nerve in the body. Yeah. The reason we call it that is its agonist is nicotine. Yeah. So I called my husband at the office and said,
start pumping dubs.
Way home. Yeah. Well, can you please stop at the drugstore and get me a nicotine patch?
Yeah.
And he's, of course, like, what are you up to? I was like, I'll explain when you get home. But I didn't know if it mattered where I put it, Natty, but I put it in the low right-hand quadrant of my abdomen. And I kind of pictured this nicotine going through the skin. Of course, it's transdermal. And could it land on the receptor of that postganglionic vagus nerve and trigger a bowel movement? Well, sure enough, hour and a half later, things started moving. The valve opened. I had a normal bowel movement. That was my reaction. Wow. So I used it again the next day. I did great. But by the fourth day, nicotine sadly activates inflammation. And my stomach was purple. It had hives. It was itching. I thought, oh no, I've ruined everything. But it taught me some things. And those lessons then were able to take me to the next level in figuring this out.
Wow, it's so incredible. I've heard of people using like nicotine gum for concentration. Like a lot of people obviously use it for stopping smoking, but I've heard of it as being used as a nootropic, but never as a bowel movement. That's quite interesting.
Right. No one had ever tried that before. And when I look back on that, I think, why didn't they? Why didn't someone test that postganglionic vagus nerve? I don't really know. Yeah. But a desperate patient, trying to figure things out. Right. And but so not being, go ahead.
I was going to say, well, what has that now led on to for you guys?
Right. Well, if I couldn't use nicotine, I know I needed to do something. And I thought, wouldn't it be great to come up with some sort of oral medication or supplement that would come into the body very quickly and be able to land on that postganglionic vagus nerve, much like nicotine did, but without the inflammation that nicotine can cause. And put my geek hat back on, went through organic chemistry. I looked at genetic issues with acetylcholine first. I thought that's got to be it, right? We have some genetic problem with this, and there are genetic issues. And I tried to figure out workarounds for those and put those in because at the time I didn't know my genes. And then tried to figure out what else we would need, everything required by the body to put together acetylcholine quickly. And then I was the guinea pig. My son was patient one, as we'll call him, to try to get answers for that. So I had goals for it. It had to be made of supplements that were already available. They had to be already determined to be safe. I couldn't wait for a new drug, that wasn't in the cards for us. It had to trigger the postganglionic vagus nerve, so we actually had a bowel movement. That was the only way I could know if it was actually working. So we looked for that. I also needed it to cross the blood-brain barrier. Yes. What was happening was acetylcholine was getting low in the brain, contributing to some of that mental exhaustion, that inability to organize my thoughts and even stay awake. And all those were important. So those were the goals. And it only took about 3.5 years to work through that.
So was it a vagus nerve problem, or was it an acetylcholine problem?
What a great question, because if I hadn't have continued into geekdom on this one, I would have walked away with this is a vagus nerve problem. But this is where being an eye doctor really helped, Maddie. If you look at symptoms of low acetylcholine, we call it anticholinergic poisoning. I say we as in doctors because there are certain drugs we can ingest that break down acetylcholine and patients get certain symptoms.
Yeah.
Eye doctors know those very well because we use eye drops that dilate the pupils. Those are anticholinergics. So we learn that pharmacology. There's no blood tests for this. You have to recognize the presentation. So I sent out checklists to groups of patients, chronic fatigue syndrome, POTS, fibromyalgia, whatever that is, right? And interestingly, PTSD, they tend to show autonomic dysfunction. And the majority of patients showed the majority of symptoms of anticholinergic poisoning. The symptoms would tend to come and go. It didn't go on to coma, seizures, and death like true poisoning would, but we knew this was likely first an acetylcholine problem, and the vagus nerve was secondary to that because that's one of the nerves that uses acetylcholine, and it was critical for getting the full answer. Yeah.
Wow. And so, I mean, you've done these tests. Like, what does that lead on to? Is and then the supplement you've essentially created? Is that what?
Yes.
As such.
And picture, I'm in the kitchen trying to put things together to make this work. And again, organic chemistry. Who knew anyone would use organic chemistry? Was actually, helpful to put this together, and then giving it to my son and I to try to get the organs working to allow nutrient absorption, and ended up, when we were able to release it finally, calling it Parasim Plus. And my thinking was, I want to say, what am I trying to say that this does? It supports the parasympathetic nervous system, that rest and digest, including the vagus nerve. Plus, it crosses the blood-brain barrier to boost acetylcholine for cognition, short-term memory. But it was also helping dry eyes. And a lot of patients would go on to these chronic dry eyes. So getting an answer for that too was really amazing. As an eye doctor, I never considered the autonomic nervous system in chronic dry eye patients. And I don't think anybody did before. So that's where the second patent came in. No one had put that together before. So an amazing journey, terribly long journey, but essential for recovery.
It really is. I mean, I know my hat goes off to you with how much effort you put into that. And obviously because you're N equals 1. So it's like, you need to make it happen. But at the same time, so many people would just throw their hands up, I think, and say, I give up, like this is too much. So that's absolutely incredible. With Parasim Plus, obviously you were in an extreme case, but it doesn't have to be for people in those extreme cases. What does that look like for someone like an athlete or your everyday person, like your everyday mum who's got 3 kids and they maybe work out once or twice a week and they just try to live a healthy life?
Right. There are so many patients who are not unhealthy that can have some symptoms. And it's real easy for us to blame high stress or getting old or whatever on, yes, I get a little brain fog, or I'm a little forgetful sometimes, or I get a little constipated. I'm under a lot of stress. I'm getting old. So there's always reasons that you can point to. But I think when it's recognized and addressed properly, you can feel so much younger. Things work better. Even just on chronic dry eye patients, to ask them, your eyes are a little dry. Do you tend to get constipated? They look at you kind of funny. And we asked, do you get kind of fatigued, mental fatigue sometimes? And to see that reverse when they never even recognize it as a problem is amazing. Now with athletes, this is so interesting because some of us have issues with inflammation. There's many reasons, autoimmune conditions, there's genetic issues, etc., that set us up for that. athletes are in a group where they purposely inflame their bodies, right?
Yeah.
And if you're building a new muscle, you have to break it down first, right? And you have to get that inflammation in there to build back that healthy muscle. And as long as your vagus nerve works well, it helps you regulate that so it doesn't run off and start destroying other tissue. But ironically, some of the same inflammatory cytokines that are involved in some intense exercise can also block the release of acetylcholine. So you can see a fair number of athletes end up with, say, constipation.
Yeah.
And being able to help them with the inflammation also helps improve their overall health, their ability to recover from intense exercise, and actually improve their results from it too. So it's not intuitive to think someone like me who was so sick could benefit from that, where also an athlete is so incredibly healthy. Can benefit from it too.
It's always been the standpoint that we've always tried to help our athletes with, is coming from it from a, hey, if we can lower your inflammation, essentially what we're going to do is put your body in a better state to be able to recover. But also it's going to minimize your risk for injury across the board. We see so many athletes who they go into competition, they get injured at competition because they're pushing their body to the extremes, but they're going into the competition so inflamed because of the training and bits and pieces they've done beforehand. So it's really quite an interesting thing. Like, that's always been our standpoint, but that's really cool that now there's potentially something that can also help aid that. Apart from maybe like signs of, hey, they're constipated once or twice a week, what other things might be showing for, hey, there's potential issues with your vagus nerve or acetylcholine right now?
You know, as you're asking an eye doctor this, one of the first things, I cannot not look at this, is the size of someone's pupils. Okay, if the light is the same, the only thing that will change the size of the pupils is the autonomic nervous system. So the sympathetic nervous system, which is activated in inflammation, makes the pupils large. The parasympathetic, that rest and digest, makes them small. So whenever I see large pupils, I'm alerted to that in and of itself. And I found that to be more sensitive and more reliable even than heart rate variability for our athletes, to watch pupil size. It's oftentimes the first thing you can notice. But that propensity again for dry eyes or mental fatigue or constipation is a big one. Sometimes patients will start flushing a little bit, get red easier. They're lifting weights, all of a sudden they're red as a beet. You know, that's kind of a clue. So, but it is a pattern. You kind of have to watch for a pattern.
That's very interesting. And so, say someone doesn't have these issues as such, is there a benefit to taking the supplement?
You know where it can be beneficial, and my husband takes it for this reason, is purely the cognition. The other reason is growing older, and I'll explain that. Growing older, we call that inflammaging. I don't know if you've heard that term.
Yeah, I have, yeah.
As we get older, inflammation naturally increases, and it increases our risk of disease, heart attacks, strokes, depression, you name it. But it also makes us more prone to, say, constipation, dry eyes. You get where I'm going with this, right? So that's something we can be proactive about. We don't have to suffer with low acetylcholine. That we can put right back in, and we can feel younger. And that's so important. For cognition, this was so dramatic for him because he got in a position where he was really suffering. He started to lose his memory, and we were so worried about him because his dad passed from Alzheimer's. I thought, gosh, could this be like early Alzheimer's, some sort of horrible dementia? And I said, well, you know, in any form of dementia, first thing you have to do is boost acetylcholine. Let's at least start you on that while the neurologist tries to figure out what's going on. So we started Parasin Plus, and it was immediately helpful.
Wow.
And then she figured out he had sleep apnea, and he needed some help with that, which was great. But to this day, he still stays on it. I mean, we take it seriously enough. We were at a hotel when we traveled once, and we forgot it. And we're like, well, let's call Amazon and see if they can deliver it to the hotel, because it was that significant for us. But for cognitive benefits, it's significant to boost acetylcholine. So my kids, I'm sorry. I was going to say my
No,
kids
please
actually
go.
take a little extra for finals. They're both in college, and
Uh,
just to get that extra boost. Yeah.
Very interesting. I'm all for nootropics. I've tried a few different ones and played around with them, and I love it. I think they're great.
Oh
So
yeah.
I'd probably test it out just for that sake, if anything else.
There you go.
When it comes to like looking at, say, your special cases of maybe dementia or Alzheimer's, have you done
Yes.
much study or use that drug with studies with those clientele before?
Yeah, no, we have done no studies on this. And importantly, this is a supplement mix, not a drug. So we have to be
Mm,
kind of careful with that. But one of the ingredients in Parasym Plus is a cholinesterase inhibitor. And
okay.
what that does is inhibits an enzyme that breaks down acetylcholine in the synapse. So it retains acetylcholine longer. It's similar to drugs for Alzheimer's, like Aricept, for example, that
Yeah.
um, uh, try to retain more acetylcholine. What it does further than that, though, it allows actually the production of it to improve. So it's a little bit more involved than that, but significant for cognition. I was just able to feel it so easily because I was so bad. And the
Mm,
worse you get, the easier it is to tell the difference. But when I couldn't stay awake, I remember when I finally figured out what to put together to make this happen, within probably 20 minutes, all of a sudden I could think better. I was able to actually
wow.
work for about an hour and a half. And then I thought, oh, okay, I have to go back to bed. And I thought, wait a minute, could I need more? I took some more and it came back again. I could work, I could concentrate for about an hour and a half. And
Yeah.
that repeated itself 5 times the first day. But the fact I could just stay awake all day
Mm,
was so amazing. And then I was able to go down to 3 doses, stayed on 2 doses for months, and then ultimately went to 1. And then I went to 0, which was a mistake because then I got pancreatitis and just prayed that getting back on that would help. And it started to reverse immediately.
wow.
So I stay at 1 now. It's
Yeah.
just something I can't go below. So, yeah.
Okay, so that's how essentially your body is able to function day to day, is
Mm-hmm.
by staying on that
It's
supplement in
important.
particular. Yeah.
Yeah, it's important for me. And everybody is different, but people who
Mm,
have genetic issues with acetylcholine or a damaged vagus nerve or inflammation blocking the release of acetylcholine will likely need to keep at it. If people don't deal with those 3 issues, they may be able to use it episodically just fine.
yeah. And so, did you ever actually get fully diagnosed as to what was going on? Like, is there a gene that you found that you had and your kids had, that if anyone has that gene, they're potentially going to find the same thing if they come across these viruses? Yeah, was there
That's
more
interesting.
detail to it?
Yeah. And we look forward to publishing this, Maddie. This is going to be important because it isn't all about me. At this point, when we were doing the studies, and we knew it wasn't all about me, but we thought we're in a great position to try to get so many answers for invisible illness people.
Mm,
So we were thinking in terms of not just me, but what else could be involved. So we're digging deep into the genes involved in certain forms of inflammation, for example. A few other things too, though, but we will be publishing that. What was interesting, though, I expected my kids and I to have the same genetic challenges,
mm,
right? We all got POTS, although our presentation of POTS was all different.
mm.
I had a form where I was basically flooded with adrenaline. Um, I never fainted. My son fainted if you just looked at him. Sometimes he would faint just trying to sit up.
Oh,
My
wow.
daughter never fainted. She was able to stay in school, but she was crippled sometimes by more anxiety, depression. That was like one of her biggest challenges at first. So
Mm,
we all exhibited differently. We had some different genes at play. And one of the genes involved with my son came from my husband, Mr. Perfect Genes, as he used to call himself. It turns out, oh, maybe there isn't such a thing as perfect genes.
yeah.
So it's the combination of genes too that comes into play. And we're all just a mess of genes. I mean,
Yeah.
it's what makes us individuals. It's when there's a certain combination and there aren't answers is when we get sick and we run into trouble. So when we're asking for what is the label or what name, what were you ultimately diagnosed with, we don't have those.
Mm.
And that's a real goal of mine, is start to label patients preferably on their genes, because that's so objective. And then say, okay, with this genetic combination, we should start to see some irregularities, say in your blood or whatever. Go, oh, and there it is. And we just tie it all together, and patients are finally validated for some of the suffering they go through. The labels we have right now are too subjective. Like you had mentioned, the irritable bowel syndrome, this just helps us like not at all.
Yeah.
Fibromyalgia, or even POTS, it is not helping at all. So we've got to do a better job at labeling those. So that's a personal mission of mine.
Yeah. Okay.
I really want to help get some labels out. Mm-hmm.
So yeah, I think that can be a major part, right? Like some people just want to say, well, I've got this. Like that's part of it. It's like, okay, once they understand what it is, maybe then it gives hope for there's a cure or there's a way to be able to build out. So saying, well, I've got this thing that might be related to my genes, or it might be related to my vagus nerve, but you can understand when that would be maybe disheartening for individuals.
Absolutely.
What is like the main group of people that come through POTS care? Like obviously they've been diagnosed with POTS to some extent, or maybe they haven't. Like what are the people you're seeing?
Yeah, they've all been diagnosed with POTS. In fact, we pre-qualify the patients. We don't want someone to come that we can't help. And there are some forms of dysautonomia that we don't see. So we have to make sure it's not a neurological condition, ALS or Parkinson's, for example. They start out with POTS. We shouldn't be seeing those people. Those are treated differently. We have to make sure this is truly what's called idiopathic POTS, meaning all of the reasons for POTS that they understand are completely ruled out, and that's where we pick up. So we're looking for patterns to illness. POTS is a diagnosis where the criteria is completely subjective, much like those other diagnoses you'd mentioned. And some of the criteria, like your heart rate needs to go up 30 beats a minute, when you're vertical on a tilt table test. And I say, okay, does that mean then if the heart rate goes up 29 beats a minute, that's not POTS? And usually the doctors will say, well, that's probably still POTS. It's like, okay, 28 beats a minute, is that POTS? Well, I guess that's POTS, and where we're kind of going there. It's like, okay, instead of arbitrary criteria, should we instead be looking for patterns to illness and identifying those and treating at the underlying source of that? So that's really what we do here. But people are already diagnosed when they come. In fact, we tend to see the sickest of the sick, and they've got no answers. So we're where they get answers.
Yeah, that's crazy. Going back to the vagus nerve and the vagus nerve function, can we talk about like why the vagus nerve, if it's not functioning properly, why you might not absorb your nutrients correctly?
Yes, I think that's a really good question, because it's just the dominoes start falling. So initially, like when I got sick, I didn't even notice, except the fact the food would stay in my stomach. As far as I could tell, I thought my GI tract was working okay, but ultimately, without stomach acid, without proper gallbladder bile or pancreatic digestive enzymes, we don't digest the food. We don't break it down properly to pull the nutrients out. When stool tends to sit in the GI tract for a long time, you tend to get more inflammation. It's not designed to just hold things there forever. So the motility is also important. And when both of those are affected at the same time, the nutrients end up not being absorbed properly. One of the first ones to go is water-soluble vitamins, but we oftentimes see vitamin D go fairly quickly because mainly the gallbladder and pancreas aren't working. And so fats aren't digested properly, and vitamin D is one of the fat-soluble vitamins, so we tend to see that go low right away. Here, and likely there, we don't consider nutrient malabsorption in someone, unless they're living in some third world country or something, unless they have alcoholism or Crohn's disease or celiac, we just don't even think of that. And even when I presented with every neurological symptom possible, and even when my son was breaking his bones, no one thought to go there, which was a huge mistake, right? Got to consider that. And on a much lower level, people just don't feel as healthy. They may not be as active. They may not be as full of energy, and we can be more proactive for that. It's pretty easy to do. Yeah.
So, I mean, malabsorption, does that go down to the extent of potentially the amount of food that they're seeing in stool?
Say that again?
Like the amount of food that's not being broken down and they're finding in their own stool? Is that like a good sign, or is that like, I don't know, not part of it?
Yeah, no, we've seen some really nasty looking stool.
Yeah, I can imagine.
We've had some patients, and it looks like they took their food, put it on a very low grind on the blender real quick, and dumped it in the toilet. That's what it looked like.
Yeah.
We've had patients with entire lettuce leaves, make it all the way through. Then you're in trouble if, say, they start vitamins or whatever, and they have a complete vitamin in the toilet. And okay, nothing's getting broken down properly. So yeah, sometimes that's more obvious than others.
Yeah, it definitely makes you wonder, like, how is that person functioning?
I know it, right?
Yeah. Yeah, wow. And so, I mean, going a little bit more into the digestive tract, talking about SIBO and the vagus nerve. So SIBO being small intestinal bacteria overgrowth. If people, does it always correlate that if you have SIBO that there's something up with the vagus nerve or not?
That's a good question. I would imagine there's some immune conditions that make it more prone for people to have GI infection, like low IgA, for example, which tends to be a genetic issue. And I could see that you could run into trouble. But the way the body usually protects itself from that is things like the stomach acid. Okay, it's high enough and low enough pH that it's designed to kill some of those nasties. They shouldn't make it all the way down there. And then the proper breakdown of the food and motility is designed to prevent SIBO, also the fungal overgrowth. And I suffered with horrible dysbiosis where that bad bacteria, good bacteria balance was ruined. I had horrible candida for so many years. The immunologist did some special testing and found that my body lost the ability to fight that. It was too chronic, but they didn't know what to do about it. We had to put back the normal gut function in order to recover from that. And for that, we found antibiotics are usually not the way to go, because then you lose more gut flora and you're starting over again. But if we can restore normal motility and normal gland and organ function, the SIBO tends to go away by itself, which is awesome.
And so what's the best function for doing that? Back to the supplement you were talking about before?
Yes. Yeah. And for some people, say they may not have been as lucky as I did. They may not have been able to save their gallbladder. We added some other supportive products to the supplement line. I was wanting to do some digestive enzymes for a while until I was sure they were humming along, but there wasn't one that existed that was gentle enough for somebody who suffered with a lot of inflammation. I wanted to support stomach acid, but I couldn't find anything again to do that. So I created some things to help from that end. And that can be helpful, especially just getting started. But the gut can recover, which is amazing. As long as the organs are still there, you've got a fighting chance, Yeah,
that's quite funny. And I mean, something that I wanted to touch on before that I didn't was about your gallbladder and the fact that you fought so much for that. Like, I think so many people hear, okay, we got to go under the knife, and that's just what they go for. It's like, okay, well, the doctor said, so I have to do it. And I'd almost urge people to get second and third and fourth recommendations before going under the knife for anything. Like, we see it a lot in sport of people even getting the cortisone injections, for instance, and they might go to one physio and that physio says, well, you need to go for a cortisone injection. I really urge people to see multiple physios, because I've seen, like, people will recommend it for a bursitis in the shoulder, and I've seen a bursitis be reversed through better forms of, I guess, physical practice on it, like massage, different styles of massage on it, as well as maybe a little bit more time when you're not resting, but it can't, when you are resting, but it can't be just go rest for 4 weeks and do nothing about it and then it comes back. Like, it's quite an interesting thing. I think that's that's something that is very important for people to understand. Like, you don't have to necessarily always go into the knife. And yes, sometimes it's great and it is the cause, and also it is the thing that we need to do. But I would strongly urge to get second and third opinions where you can.
I agree. I've kind of found in this journey, I got really lucky by walking away from some things. The gallbladder surgery, certainly. There was a time they thought a neck fusion was necessary, Chiari surgery, a brain shunt. Oh, it just goes on and on. And sometimes less is more. If you talk to people who are diagnosed with this chronic fatigue, or they fall into kind of invisible illness, you will see a lot of gallbladder surgeries where really nothing good happens from it.
Yeah.
And this is something the surgeons usually recognize. They just don't know what to do with that, so it was great being able to get that answer, so that we can avoid procedures. They're not risk-free, makes life a little bit harder. And if the patient's inflammatory, then just the procedure itself riles up more inflammation. Then you have that to deal with too. So yeah, I agree. Less is oftentimes more. More opinions are a good idea.
It's almost like there's a whole lot of things coming out about fluoride right now, based on, I don't know if you've seen this, but it's all based on the fact that a lot of dentists are not willing to go back against it now because they've said it for so long, and it's almost like it's proven to not do anything for the teeth, right? Like, and all the studies are coming out saying it now, but everyone's almost in that well, it's almost like an ego thing, isn't it? Like, we're too big to admit that there's anything wrong, so we're going to continue saying the same thing, even if it might not be right. And I feel like science is awesome for doing the things that it does, for disproving things, but then humans are another race that need to deal with that as well.
You are so right. And I found in this journey, it takes so long to change the paradigms like that. And even in the face of objective evidence, it's painfully slow, which was very frustrating to me. We were moving so fast and getting answers. We had to. We didn't have a choice. But had I stayed strictly with an academic institution, going through, raising money for the study, doing a study, and then spending 5 years to publish, et cetera. Oh, no, we could have never gotten any of these answers in time. So it was hard to see, even when things were released, that it was so hard to get everybody together on this. There had to be consensus. We need to have proper labels, et cetera. It's very long to do it. Very frustrating. Yeah.
Excellent. No, I can understand that 100%. I think, like I said, I take my hat off to you for what you've done and how you've progressed forward. Like, so many people would do it for themselves, but potentially not document it and show it for everyone else. So, Diana, is there anything that I haven't asked maybe that we could have brought to light around the vagus nerve that we should have?
It's a good question. I think you did a great job in covering the vagus nerve. I think it was so overlooked for so long, and yet it's such a critical organ, or critical nerve for healthy organs and overall health. I think one key piece, though, is recognizing, is it really a vagus nerve problem? And one other thing that kind of occurred to me going through this was, my entire life, I didn't have to do anything to stimulate my vagus nerve, right? It worked all by itself. It was part of the autonomic nervous system. So why would I, once I got sick, have to make it happen? So that was a clue. And it's easy to forget that if we're having to work too hard at stimulating that nerve, maybe something else is going on here. And if it's an acetylcholine problem, we can fix that, because we shouldn't have to work that hard at it, right?
No.
Yeah,
so interesting. Well, I would like to thank you very much for joining us for today. This has been really insightful. It's really quite cool.
Thank you, Maddie. It was really an honor to be here, and you've got such a wonderful podcast going. You're helping so many people, not just with illnesses, but also being the best they can be in health. And it's such an awesome combination. I will tell you, as someone who went through something, quote, invisible or unquote, that people like you getting out there trying to share information would have been so welcome. I just couldn't find anybody. So there's so many people who want that information you're getting out, and it's such a great thing to do, and you're doing a great job of it.
No, I appreciate it. Thank you. Thank you. And likewise to yourself. I mean, we actually have set up a discount. I just can't remember what the discount is for people to try out the supplements as well. So I will do a little pre-recording about, and the podcast to figure, once I figured out what I set up the code. I'm pretty sure it's TCL, but I'll just double check on that.
That's great. I have no idea.
Yeah, I'll look into that and do some research and let the people know before we get into it. But thank you very much. I think it's been a really cool interview, Diana. So where can people follow along if they have any more questions or anything like that? Where's the best place to kind of find you?
I'm kind of spread out, right? The supplements, and there's a fair amount of science and information is on the website, vagusnervesupport.com. I'm at POTS Care, of course, which is potscare.com. And I started a blog when I was sick to try to reach out to people who were sick to say, oh, this is real and this is bad. And as I got answers, I started to share that. So I have a forum there, and have answered questions for free for years and years and continue to do that. So that's at prettyill.com, where it's undergoing a little refreshing right now. I really want to freshen that up for people, but that's been a great way to help people who maybe couldn't reach me personally too, because it's all about helping each other at this point.
Yeah, definitely. Well, that's incredible. Well, thank you very much for your time.
Thank you. I enjoyed it. Appreciate it.